you're interested in learning more about becoming more of a concussion rehab professional, why don't you tell the audience who would be appropriate for this and what this entails?
Yeah, this course is mostly for rehab for professionals. We've had a number of different disciplines take it, from nurses to doctors to sports medicine physicians, chiros, PTs, OTs. A lot of it is centered around, it's just an evidence-based course. So it walks you first through international consensus statements and different consensus guidelines. There's a section on neurology and just kind of an update on that, and then into pathophysiology, going over all the blood flow mechanisms and that type of thing, getting into biomechanics, implications for the C-spine, into our battery for baseline tests, and et cetera, into acute concussion evaluation and assessment, red flags, when to refer, then moving on into clinical management for concussion, return to learn, return to work, return to play, and then into post-concussion syndrome and what the evidence shows about that pathophysiology and what are the different mechanisms, and then getting into post-concussion syndrome treatment. And that centers a lot around rehab. That module alone is, I think, about 10 hours long.
Oh,
So
wow.
it's a big module that covers all that stuff. And then we actually get into chronic traumatic encephalopathy and other neurodegenerative conditions with concussion, and then into kind of how to implement, this program into your practice and help it grow as a component of your practice. And so, as you mentioned, we've put up a discount for the prehab guys, just for that blog and everything else, and to kind of promote it. We've put up a discount on there, so you actually save $200 off our course if you go through that link. And you don't have to start the course right away, but once you do start it, you get 60 days to complete it, because we want to make sure people are moving through it. We don't want somebody to do module 1 and then come back to it in a year and completely forget everything they've done. So we have put a timeline on it to try and make sure that people are actually just getting it done. So, but even though the link expires on June 1st, you don't have to start the course on June 1st. You can start it, whenever the hell you want to. But once you do start it, then you got to be moving through it, at a decent clip. It's about 40 hours long, so it's an extensive training course. But like I said, we're trying to make people understand everything that we currently know about concussion, because we need clinicians to be experts in the area to really, because a lot of it is just education. It's reassurance. It's making sure that people are they understand what the implications are and what can be done to help it. So that's it.